The next talk is Harmeet Dhani, Proteomic expression using exosomes in Intraductal Papillary Mucinous Neoplasms to inform risk stratification.
Hi, everyone. So today, as he had said, discussing proteomic expression using exosomes in IPMN patients to inform risk stratification. This is my disclosure. So as an introduction, and Dr. Wood had set up this pretty nicely, I want to talk a little bit about IPMNs. So IPMNs are the most common type of mucinous cysts in the pancreas. They can be precancerous lesions, or if you don't like the word precancerous, lesions that harbor a risk of malignant progression. The risk of malignant progression varies depending on subtype. So we have, for example, here a main duct pancreatic IPMN that harbors a risk of about 60 to 70% progression transformation into a malignancy. This is very different from a side branch duct IPMN, which harbors about a 5 to 10% relative risk of transforming into an pancreatic cancer. Because of this, the management of these patients are very different. So in patients with high risk and some worrisome features, surgical resection is indicated in these patients. While in low-risk lesions, surveillance with invasive imaging is recommended. However, current diagnostic modalities often make it very difficult to reliably distinguish between low and high-risk lesions. Surgical resection is often performed in clinically indicated patients, but of those patients, surgical pathology often have low-grade dysplasia or benign disease. In fact, in literature, it's been reported that up to 30% of resected IPMNs are found to be benign with no malignant potential. These patients arguably could have been benefited from a more conservative approach, such as watch and wait surveillance programs. Therein lies a clinical unmet need, where there's a need for an accurate and less invasive clinical tool to risk stratify these patients to discern histopathological grade and inform treatment decisions. Because of this, we conducted a pilot study that aimed to evaluate the association of IPMN characteristics with proteomic markers expressed on exosomes. Here is a snapshot of the methodology that we used to do this. We took plasma of patients that were collected at the day of surgery and retrospectively, and we injected that into our proprietary technology platform that isolates exosomes based on ACE. ACE is alternating current electrokinetics, which is found to be far more superior than the gold standard of ultracentrifugation of isolating exosomes. Then we can measure these biomarkers and quantify them through a multiplex ELISA, and then through a machine learning algorithm, come out and produce a disease classification or RLC curve. Now, when you look back on our patient population, we took 19 patients with IPMNs who underwent surgical resection, all clinically indicated. These patients either got a Whipple procedure or a distal pancreatectomy. And this was done between 2015 and 2021. And what you see in an average age of 69 years old, that pancreatitis was predominant in about 14 patients out of the 19, either on historical EMR records or found on the surgical explant. On the right, you can see that there were 13 patients that had a main duct involvement or a mixed type involvement of an IPMN. And on surgical explant pathology, 10 of those patients were low-grade dysplasia, while 9 of those patients were found to be high-grade dysplasia. And when we double-click on the extracellular vesicles or the exosomes, in terms of biomarkers, we find the following. In patients with high-grade dysplasia, when compared to low-grade dysplasia, we have a biomarker A, that is statistically significant and increased with a p-value of 0.0241. Similarly, when we looked at markers B, C, and D, we found that these patients also had statistically significant increases in patients with main duct or mixed type IPMN versus branch duct or unspecified IPMNs. To conclude, in this pilot study that evaluated 19 patients with surgically resected IPMNs, we identified one biomarker that was significantly elevated in patients with high-grade dysplasia versus low-grade dysplasia, 3 that were elevated in main duct and mixed type IPMN compared to branch duct unspecified IPMNs. And these findings preliminarily suggest that these proteomic markers can potentially lead to a development of an algorithm for IPMN risk stratification. Further studies will be needed to expand on these results with the aim to identify an expanded panel of biomarkers that can truly help stratify these IPMNs to guide medical decision makings in the future. Thank you very much.